Yes. When you're smiling, the whole world, it smiles with you.
All right. Glad to have everybody here on News
When
Talk
you're
790
laughing,
WNIS for another Ask the Expert show with Dr. Adam Hogan from Full Implant Choice. How's it going, Dr. Hogan? Glad to have you back again here on our airwaves for this hour. How are you?
I'm doing great. It's been a good day. It's been an interesting day, a little stressful day, but we'll get to that. But thanks for having me.
Always a pleasure to have you. And with a proper introduction, broadcasting a mile high from the foothills of the beautiful Rocky Mountains.
Recording in progress.
Magic Mountains. I know I had something going on in my ear. Broadcasting mile high, Dr. Adam Hogan. You're actually out in the beautiful Rockies right now, aren't you?
I am. I am finding myself spending a week in Denver, Colorado for personal reasons, not all vacation. We'll get into that a little bit, but exploring the city mostly from my hotel room and medical offices.
Awesome, awesome. That's great. I know that a lot of times people travel all around the world, rather, to come here to Hampton Roads to meet with Dr. Adam Hogan to talk about dental implants, and that's kind of what we're going to talk about today is dental implants, and for everybody listening to know where to go and make the right decisions that they need to make. But Dr. Hogan, you have a special topic in mind that you want to focus tonight's show on. Tell me a little bit more about that.
Yeah. Let me paint the picture. So we are in Denver, Colorado. Um, and we're here for a medical reason. And it's it's very much hitting very close to home for everything we do at Full Implant Choice with for dental reasons and dental implants and teeth in a day. So uh, I found myself out here in Denver getting my wife taken care of by a specialized doctor in vascular surgery. And it really didn't come as an easy segue to get to Denver. It's been about 8 years in the making, and we've already had surgery one time back in Hampton Roads. But I've realized how, and these are things I've always preached upon here on WNIS, but how important it is to do your research on the surgeon or the office that you pick to do your dental implants. It's just like it's hitting very close to home. So I want to talk about that this hour. I've had a long sleepless night. I literally just got out of the hospital about an hour ago and got set up for this live broadcast. So, I mean, barely responsible for what comes out of this noggin at the moment in time, but you know it's all going to be truthful like it always is.
No, and as always, we're glad to have you here on these airwaves and appreciate you to take your time, during your travels to have that important conversation with us all. And for everybody listening, I want you to write down real quick the phone number and the website to get in touch with Full Implant Choice with Dr. Adam Hogan. When you need more information, if you're getting in or out of the car, you got to know where to go. That's fullimplantchoice.com. Full Implant Choice with Dr. Adam Hogan. Pick up the phone, call right now, get a consultation scheduled at 757-629-4259. That's 629-4259, or again, online, 627-70. Well, online at fullimplantchoice.com. You can call us here at the station too, and we'll get you taken care of as well.
Right. And I appreciate that shout out. You know, I've been on these airwaves with you for so long, probably, I don't know, 5 or 6 or 7 years.
Yeah,
And
at least.
I treat this more like a discussion between friends, and those listening, that know us. It's just kind of an honest discussion, almost like a podcast, if you will. But yeah, we're here for Full Implant Choice. Thank you for, thank you for
Just
bringing
want to
that
throw that out. Yeah,
up.
people are in and out of the car, but uh,
Fullimplantchoice.com. So let me
yeah.
let me let me tell you a little. I tell you all the time that you listeners, I tell you all the time, don't search cost and convenience for your healthcare, right? Cost or convenience. Search experience and research and vet the doctors you choose to treat you. I say that all the time across the board. Now, I personally would never search cost for healthcare, and I wouldn't for a family member either. That's not the basic background of this scenario. The background of this scenario is that I've got a family member with a more rare condition. And I don't know that it's all that rare. It's just that most doctors haven't been trained on it or know about it really well. And so I found back home a year ago, we found somebody that was just highly recommended. Okay, this person's great. Go there. Not going to say any names. Okay, so we didn't really do the background check. We've been going through a medical problem for about 8 years, and we were just like happy to finally find somebody. And we were like, okay, that's the doctor to go to, go there. Well, it did not get the procedure did not get done well. So I'll say probably it was convenient. Okay, because we had a referral to go to this guy who was supposedly great. I didn't really do my background because I trusted the referral. I didn't really do the background checks, and we thought we were finally in the right hands then. And things did not end up going well. In fact, the medical procedure made her feel worse over the past year. So we had to dig down a rabbit hole of, finding suitable doctors around the country, and we finally found other patients with the same scenario, and it finally stirred us to Denver, Colorado, among other cities. We had about three choices. And so we've taken the time to come to Denver to have the procedure done correctly by somebody who does this medical procedure every single day. And in fact, I've heard this doctor talk to my wife over the phone a couple of times, but meeting her in person, this doctor out here in Denver, I'm going to give her a shout out. She's great, Dr. Spencer in Denver, Colorado. She was thoroughly knowledgeable. She does this every single day. She really made us feel great. She explained talked to us for an hour before the surgery, again in live, even though talked to us a couple of times, virtually. And you get the feeling like you're going with someone with experience who knows what they're doing, and not just experience, but repetitions, doing it every single day, day in and day out. There's something to be said. I say this all the time, Damien. You've got people that have 10 years experience but haven't done it in the last 10 years. That's not the same as somebody who's got 10 years experience but is still doing it every single day. So these things hit very close to the home to the messages that I'm telling you, you listeners, about full implant choice and dental implants and same-day teeth and smiles and changing your life. So I'm talking to Dr. Spencer this morning for a good long time, and it comes out how frustrated she is because she sees day in and day out, she sees cases that are done incorrectly that she has to fix. And I'm like, this sounds very familiar. And then she's saying, I wish they wouldn't even attempt it in the first place because fixing it the procedure would take me an hour, but now fixing it takes me 11 hours, and it's so much harder. And I'm like, this sounds just like what we talk about at Full Implant Choice with teeth and same-day smiles and dental implants. And she says she sees, cases incorrectly diagnosed and incorrectly treated all over the country every day, 3 or 4. I'm like, this sounds exactly like Full Implant Choice, and what we see with dental implants and same-day teeth in a day. And it's just, it just really hits close to home because we're always preaching this from a dental perspective and teeth, and now it's very closely affecting us on the medical scale. And I'll let you ask questions, Damien, but I mean the list of similarities just goes on and on between her profession and mine and what we're trying to do to help people. And go ahead, Damien. You must have questions.
No, I'm just, it's just not ironic, but it is, I want to say just par for the course for sort of where we are today in so many aspects of trying to find good help when it comes to the medical field. It's just like yourself. You can go to a lot of different places and you're not going to get the same result in different places. You really got to do your own research. And unfortunately, a lot of people get the short end of the stick. They make one bad decision and then it has big consequences on their health in many medical fields. And then we often talk about it, as you said, when it comes to dental implants, and fortunately, at least with dental implants, it seems like the revision Well, I say that. I was thinking the revision might not cost you a huge part of your health, but I could see it absolutely could. If you were one of those people that got you thought you were getting a deal, went to a place and came up with an infection that you didn't expect from another country or whatever the case may be, and you're right back into that situation of paying three, four, five times in the cost than you should have, let alone the cost and consequences on your health. It's tough. And what do you say to that when people have to make those decisions? They have to make a medically important decision, and dental implants is just as medically important as a lot of decisions we'll make because,
Yeah.
as we know, the health of our teeth directly, can affect and impact the health of the rest of our body, our heart health, our lung health. A lot of things are related. But how do you help coach somebody along when there's lots of quote unquote competition when it comes to
Yeah.
big corporations for one, or people that throw hundreds of thousands of dollars into advertising for whatever the field may be.
Yeah. You know, wow, so many questions, so many topics you just brought up there in that little question that you generated there. It's tough for the public to discern, doctors because everyone assumes that all doctors are the same. They
Mhm.
graduate, they get a certificate, and they're all the same. And it's not nothing could be further from the truth because and my wife, she said it leaving the hospital today. She said, it must be hard for doctors because you go through 4 years of college and you go through 4 to 7 or 8 years of training, and then you still have to undergo training. And you're tired of training. You don't want to pay for more training, but the fact is you still have to go through training for specific procedures. And how this came about is Dr. Spencer said to us, she said this morning, she said, the problem is that doctors graduate from their surgical residencies, vascular surgical residencies, and then they think they're an expert and they think their learning is done. And they think they never, and you can't, they get narcissistic, egocentric. You can't tell them a thing. They already know they're the expert in their field. And it's just, you try to educate them that, hey, you have to go take more training, and they're just stonewalled. And the same can be true for dental professionals, whether they graduate dental school or a specialty program, some more than others, but they get their certificate and they go, I know everything. You can't tell me anything. Well, you got a certificate and a degree, but you have zero experience. And also, your training program, it may not teach this specific surgery. So we do dental implants in the all-on-4 procedure, basically. The all-on-4, it's a quote, trademark term, whatever. Full mouth, same day, teeth in a day. If you're wearing a denture or your teeth are terrible or hopeless or you hate your smile, we can replace them in the same day. Okay. That is a very small subset of 4 or 6 or 7 years of training. And you might only see a handful of cases. And the same is true for this doctor in the vascular surgery world. With what my family member has, very rare condition, in 7 years of medical school and surgery training, you might only get to observe 3 or 5 cases. And that doesn't quite make you an expert yet. You have to go through and get some experience and take more training and then focus in that. So I've taken our practice into just focusing in all-on-4 and dental implants. And so, like Dr. Spencer said, the problem with vascular surgeons and surgeons in general is they get out of school and they don't ever take any more training, and then they start doing these procedures that they know little about, and they start screwing people up and they start hurting people. And now the good surgeons will fortunately admit it and have the chance to correct their mistakes before it ends up in another office or becoming a long-term chronic problem. But the bottom line is, if you took the education and put in, get the mentorship and you put in the experience and, did this every day, you'd get better at it every single day. And she was frustrated about all the revisions she has to do. I'm the same. I said, you and I are the same. I'm just in teeth. I said, every day I'm getting revision work. My phone right here for those that are, looking at this, I'm going to put this on YouTube probably later. My wife is recovering, and I get 2 emails in that short amount of time from doctors around the country. Hey, I've got a case that didn't go so well. Can you take a look at it? Sure, why not? They're going to send me the CBCT. I'm going to review it after this. I've got to call these patients in. One's from Georgia, one's from Northern Virginia. I'm gonna probably have to treat them in Virginia Beach. It's fine. It's what we do, but it's so much harder to do on top of already failing work. And it really, I just want what's best for the patient. And I'm not saying I don't want other doctors to try to learn this and become good at it. I was new at one point too. And, humbly, I'm just doing what I can do through God's hands. And you're always judged by your next case, and each one's, specifically important. But, it took a long road to get here, and it needed a lot of education, a lot of training. And what I see in dentistry too is much like what Dr. Spencer is seeing in vascular surgery, is that doctors have a degree in dentistry. They get a general dentist certificate, or they get a specialty license, and they go out and they go, okay, I'm an expert. I'm just as good as anybody, and I'm as good as anybody who's been doing this for 20 or 30 or 40 years. And they're doing their first case or their 100th case. And education, on the academic level at the institution, it's all, in my opinion, it's very broad and not really focused in anything. It's not, especially same day teeth. And you see a lot of even specialists making mistakes and a lot of general dentists making mistakes. And they're kind of, you just don't know what you don't know. I think that's the problem. And none of us is really an expert until you've done 10,000 implants or 2,000 smiles. It's really funny. Dr. Spencer's talking about how she's done 2,000 revisions or 2,000 of these surgeries specifically, and almost 10,000 vascular surgeries. And I'm like, wait a minute. I've done more than 10,000 dental implants and almost 2,000 smiles. I'm like, we're about the same. And she's like, I've been in practice 26 years. I'm like, I think I'm 21 or 23. I can't, I'm like, this is like the same thing. You're the female version of me in medicine that I am in dentistry. It's crazy. But we're talking, and it's like when we're 5 or 10 years out, you think you're smart, but you don't know until you have that experience. And I talked to my friend, oral surgery buddy of mine out in Texas and California. He has practices in Texas and California. And he says to me years ago, and I was like totally correct, but he says, you're not really an expert in your own field until you've had a chance to correct your own failures and see your own failures and correct your own failures, and do that enough times to really figure out what works and what doesn't work. Because what works in a textbook, or what works because, you think it's intuitive, it may not always work, and it may not always work on everybody. And so, there's something to be said for that experience. But, yeah, this was really just a mind-blowing, eye-opening experience. I mean, we're sitting in Denver to get good care. And I'm in Virginia Beach, full implant choice in Virginia Beach. And we're having patients fly from Florida and Georgia and Texas and Wisconsin. I'm just thinking in the last few months. And I'm starting to see more of that every day. Leaving the hospital today, two emails like, hey, can you look at my patient and fix them? It's not going that well. And I don't know where to go from here, but it's hard work, and it's work I'm certainly up to doing. But I mean, I want to see people get good care the first time, every time. Which, another reason we opened the Institute, the Education Institute, is trying to help other doctors do this correctly.
No, and well said. And again, for people just joining us, we're here with Dr. Adam Hogan with Full Implant Choice, and talking about just your experience, but and just your experience too with dental as well as medical, people just joining us. But no, I think there's something really to that old adage about you're not really an expert at something until you've done at least 10,000 hours of just that one dedicated thing.
Right.
It really is 4 years, 8 years of whatever school isn't ever going to get you 10 years worth of the actual hands-on skill of something. So it's kind of scary for the people listening, for somebody that might need dental implants, or that needs an important surgery. And I guess it's a benefit to know that we're in a place here in this country where people can go across the country to get great medical care. It's kind of a bummer that in a lot of cases you need to do that, but having the internet available and shows like this where people can get the knowledge that they need to make a good sound medical educated decision for themselves, family members, and let people know. So I want to throw out the word, everybody listening. We've only got a couple minutes here until our break, but we all have that loved one in another state or in another place that needs dental implants, whether it's hopeless teeth or whether it's dentures. There is a solution, and you can make that decision right the first time. Full implant choice will help everybody out. At least our WNIS listeners know where to go. It's in Virginia Beach, very easy to get to, and the phone number is 757-629-4259. That's 629-4259. You talked about the Atlantic Implant Institute as a great place for ongoing education for doctors. What is that? Because that is so important. I'm glad you mentioned the ongoing education and the importance of that.
Yeah. Well, we started the Atlantic Implant Institute a few years ago, and it's specifically dedicated to teaching dental implants, teeth in a day, same day smiles, and how same day smiles can rejuvenate your life and change your life for you listeners out there. But specifically for dentists, the institute is to teach dentists and specialists how to do this procedure correctly. The problem that we were addressing was that prior to forming the Atlantic Implant Institute, for about the previous, I'd say 5 to 7, 8 years, I had a lot of doctors coming to my office to try to learn how to do this procedure. And they were general dentists and they were specialists as well. So your oral surgeons, your prosthodontists, your periodontists primarily were coming to spend time with us to find out how to do this procedure. And I began to notice that they're coming in and trying to learn how to do this dentistry in 1 or 2 or maybe sometimes 3 days. And, it was great. Good on them to come in, by the way, because they're learning and they're doing their diligence to try to get better. But I was thinking, we really should be teaching this in a more formal format, with didactic instruction and hands-on, and we do cadaver training and we do live surgery training for people, because you just can't learn surgery and prosthetics for the mouth, for the face in 24 hours or 48 hours. And sadly, that's what a lot of doctors may do, is they might go to take a weekend course and then come back and try to do it, and that's what we encourage them to not try to do. But education is certainly a piece of that puzzle, where they get educated on how to do this procedure, and then they get mentorship and ongoing experience, and they grow within their comfort zone and their confidence zone and within their expertise and skill set. But the problem we were addressing is that I had even specialists coming to my office saying that they weren't taught this at the institution level. So, and by and large, are we getting ready to go to a break?
Yeah, we're going to get run over by the news here in just a couple of seconds.
Again, okay, go ahead. We'll come up.
We've got so much to talk about, so stay with us after the quick break. We'll be right back.
Between 6 and...
All right. Welcome back, everybody. So glad to have you here on News Talk 790 WNIS. We're here with Dr. Adam Hogan with Full Implant Choice in Virginia Beach, specializing in full mouth restorations. That's what we're talking about. We're talking about same-day smiles locally with some of the best and most experience that you'll find anywhere when it comes to dental surgeries and dental replacements and implants. That's Full Implant Choice in Virginia Beach. But Dr. Hogan's on some travels out west, mile high at the very base of the majestic Rocky Mountains in Mile High, Denver right now. So glad to have you here with us on this wonderful Tuesday there. How are you doing there, Dr. Hogan?
I'm hanging in there. Been a long night and a long day, but we're getting through it.
Good. And glad to have you here on the second half of this show. We were just talking about ongoing education and the necessity of that for dental professionals such as yourself, or just surgeons and doctors to offer the best, most up-to-date care for their patients, and how important that really is. We were talking about that before we got cut off by the news break. But I know that we were talking about how you teach people and other doctors about doing same day implants or same time implants, and how to become successful with doing that for their patients. But tell me about that for yourself and your staff, the ongoing education with the changing of technology or procedures or techniques, skills developments. Do you ever find yourself learning more as you go on after 20 plus years and tens of thousands of surgeries?
Every day. I learn every day, and I'm never done learning. And I think the doctor who thinks they're done learning is bad doctor. Bad, just don't go there. The doctor who thinks, well, I graduated my program, my surgery program, and or my specialty program or dental school. I'm done. I know it all. I'm an expert. Don't not a good place to be. I think when I'm done learning, that means I'm done. I think I should retire, and I'm definitely not done learning. And like our friend, doctor in vascular surgery, like she said, so many doctors graduate school and they think they're just done learning. And, there's so many advances in medicine and dentistry every single day and week and month that if you stop learning for a year, you might as well be 1,000 years behind. So we were talking about the Institute, I think, when we broke. And why we started the Institute was a few years ago, we started the Institute. We kicked it off, the Atlantic Implant Institute, where we teach how to do same day surgery and prosthetics for patients safely and effectively. And the calling or the problem that we were trying to solve was that for about the previous 5 or 7 years before that, I had had a lot of dentists and specialists coming to my office trying to learn how to do same day smiles and learn how to use digital technology and whatnot. And what they would say to me, and literally specialists in our dental field and dentists, they would say, yeah, I went to this great institution, got this certificate. I love it. I have no regrets. But when we talk about full mouth same day teeth, I had very little exposure in that field. I had very little exposure. It's a very specialized surgery and prosthetic procedure. And, good on them. They came and did more training. But I realized that them coming in just for a day or two, you just can't learn this in 48 hours. So we created the school, didactic training, hands-on training, cadaver training, live patient observation, live surgery, a stepwise continuum, and then mentorship. So I think that that's responsible education, where you take someone all the way through and you keep on mentoring them, because education is one thing, but then you have to get reps and you have to get experience. And you're going to run into problems. And you need someone to talk to. So we started this school for that. And the other part of the void or the problem we were trying to fix is that I was seeing so many cases come to my office that were done not well, if not poorly. They were done badly and they needed revision. I realized doctors out there need more training. I also learned that I learn continually through training other doctors. I steel sharpens steel, as they say, and you keep on, honing the sword. So it was just a win, 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 win situation for everybody that we invest in this training for other doctors. And it's a big, it's a lot of our time, but there's a lot of gratification knowing that the public is getting hopefully better treatment and better doctors are getting better awareness of what they don't know. But yeah, we're out here in Denver for a week taking care of a medical situation for a family member because, a doctor in our neck of the woods didn't have specialized training in this specific procedure. Yes, vascular surgeon, yes, surgeon, vascular surgeon, but not, didn't have, and admittedly said he didn't do many of them, only did two or three. So he wanted to get another doctor involved who did a few more. And, we were comfortable with that because we didn't realize the gravity of the situation and how big of a situation it was. And also we were referred there, this guy's the best. And we didn't really do our diligence. So couple of messages. I mean, one out there, do your research on your doctor. If you're referred to see myself, Dr. Adam Hogan, Full Implant Choice, I hope you do more than just read my biography. I hope you go online, look at my work, look at my cases, look at past patients, look at testimonials, talk to my existing patients. I mean, call my office. I will give you some phone numbers. You can talk to our patients. And if you're not comfortable, if you don't trust what we're doing, you don't think we're the right fit, fine. Go where you're comfortable, but do your diligence. Don't just go to the office that was next available. Okay, I'm only free on Tuesday at 3 o'clock, and that place had a consultation, or they were 2 miles up the street, or it was simple and easy to go to. Do your diligence. Check your references. Check, the credentials, training, and check how often does the doctor do the procedure. because there's a big difference between I do it 10 times a year or 10 times in my lifetime, or I do it 10 times, a week. There's a huge difference. Are you doing 300 of these a year or are you doing three? Because that's typically the numbers of what it boils down to. When we talk about same day smiles, teeth in a day, or the quote unquote all on four procedure, all on X, all on whatever it takes, I like to say, um, there's not a lot of very experienced doctors in the country that do it every day, a handful, maybe a couple thousand out of 300,000 or 400,000 dentists with license, maybe a couple thousand. We're talking 1%, 2% of dentists that do it most every day. And most people are dabbling it. Now, again, it's okay to be a doctor and be starting on your career and journey. We all start somewhere. But I think, one, are you transparent in that? If you're a doctor, do you tell a patient, it's my first case? Do you tell a patient, I only do this once a month, or I've only done 10 of these? I know when I did my first dental implant, her name was Janet, and I told Janet, I said, I've never done this before. I mean, she said, I know. She said, I think you'll do a great job. Okay, fine. Transparency. It's fine. She knew. I didn't go on Google and take out $30,000 a month in advertising and said, we are the full mouth expert after just coming off a 3-day course, out in, whatever, Arizona or somewhere. So it's really about the patient knowing the doctor and knowing their certifications and their credentials and being comfortable with that. So, I mean, we all start somewhere. All doctors start somewhere. But there's a responsibility to do this correctly the first time, for sure. You have to do it correctly the first time. And, looking back at my own cases over 20 years, I certainly would have done things differently through those first 5 or 10 years than I do them now. But you don't know what you don't know until you have the experience, the repetitions to go, okay, it would be better this particular patient. I've done enough of these cases. I've got subsets of patients, but I've also got outliers. And I know that this particular patient needs it done that way, not according to the textbook. So, there's a lot that goes with experience. And we're kind of finding that out the hard way in medicine at the moment, which is the reason why I'm in Denver, Colorado, and taking 10 days off work.
No, and well said, and I'm glad that you guys can take that, that time and that travel, and for people listening, what that means, what the experience that Dr. Adam Hogan is talking about at Full Implant Choice with himself and his staff when it comes to dental implants equals to you and I, the patient. What does that equal? What does the experience of you and your staff versus something else that somebody might make a decision to go somewhere else? The convenience you mentioned. Oh, the place is right around the corner from my house. Oh, they're having a big discount, a big sale. Oh, my cousin went there. And again, they're right around the corner. Real easy to get to. I'm just going to go there. It's okay. I liked that person. They had great bedside manner. I laughed. A lot of times sometimes that's what people base their decision on. But you tell me, what separates, tell me about the experience. What does that mean for the person getting the procedure done?
Well, nothing is going to guarantee 100% of the time a perfect result first try. But, just experience, though, in general, it means that you're more likely to have a great outcome the first time, far more likely to have a great outcome the first time. But most importantly, if for some reason something isn't going perfectly, if for some reason something isn't optimal, if for some reason there is the slightest hint of a problem, the experienced doctor is probably going to recognize it more early and treat it effectively before it's a big problem, or be able to recognize it in the first place before it's a big problem. Not just go, early on, you're just like, as a doctor, your first complication, you're like, well, what the hell was that? You don't say it out loud, but you're like, what the hell happened there? And you have to go figure it out. And the experienced clinician goes, oh yeah, I've seen this a dozen times and I know exactly what to do and it sucks, but let me just tell you what's going on. Let me tell you how I'm going to fix it. We're going to get you through this. Because in medicine and in humans and biology, nothing is 100%. The best doctor is not going to have 100% results every single time. But the best doctor is going to recognize when they're not having an optimal result. They're going to see it. They're going to admit it. They're going to identify it. They're going to tell the patient, disclose it. Then they're going to try to fix it before it becomes a big problem. That's a good doctor. And experience is probably the number one factor that goes into being able to recognize and disclose those problems early on. None of us is perfect. And doctors are just like regular people. I mean, there's books on this, like in Confessions of a Surgeon. I can't remember the author. They talk about this. You're supposed to be able to be this perfect, infallible surgeon, doctor, prosthodontist, whatever. And you're also at the same time human and you're fallible and you might make some mistakes, but you know how to fix them, or hopefully you do fix them, and hopefully you do admit it. That wasn't the same, what we had back when we did this medical procedure the first time. Doctor didn't admit they made a mistake, didn't want to address it. That's why we're here in Denver. And now I think we're in the right hands. So that's, I think, what experience means to the patient is that you're probably going to get a better outcome the first time. But if you don't, your doctor at least is going to be able to recognize it, admit it, disclose it, and treat it and fix it. And I think that's the biggest part of experience.
Oh, no, absolutely. That makes all the sense in the world. And it kind of relates back to what we were talking about at the beginning of the show, was revisions, in the fact that if you and I, the person driving or listening to the show right now, makes the wrong decision in the surgeon, in the doctor, to do our same day procedure or our dental implants, whether it's one or it's all of our teeth, if you make that decision wrong and you go to the wrong place, and or you make that decision based on information that wasn't, correct, whether not knowing the experience level of your doctor or not knowing the real reason why you chose that particular dentist, that means that you're probably going to have it done again. You'll be on that long list of revisions that Dr. Hogan and the staff have to see every week. And every month, of people that went elsewhere and thought they were getting a good deal and thought they were getting a good experience. And turns out they're going to have it done over again. And like you said earlier, it's almost never as easy the second time around, after somebody's kind of already, another doctor's already been in there and kind of made some mistakes, to go in and clean all that up and then make it right again. It's kind of like building a new house on top of a bad foundation in some, in just a simple analogy of it.
No, absolutely true.
I seem to have lost audio from you, but we're here with Dr. Adam Hogan with full.
I'm back. Sorry about that.
No worries.
I apologize. I accidentally hit my button for my mic, but yeah, great analogy on the house, by the way. I use that all the time because people can understand that a house or a car, or, you're like, you build a house, you want to build a house and you want to save some money. So you go with a convenient or a cheap builder, and then it's not going well. Then you got to go in and renovate, and you got to fix on a bad foundation, bad lumber, bad building code, whatever. You get it. I mean, then you spend 3 times more money, and the product you get it's like it's still not as good as if it was done the first time. And we see the same thing in medicine, dentistry, and any surgeon out there listening knows that when you go into a same area of the body a second time, it is very hard. It is very hard to do. Scar tissue, less available healthy tissue, less available bone. The patient is traumatized, psychology, psychiatric issues with that. It's almost like a trauma, PTSD for the patient. Like, I've already done this and now I have to do it again. And so it's like 4 times harder physically, and it's probably 9 times harder psychologically. And it's just not a good place to be. So don't search cost and convenience. I mean, I'm here in Denver for a family member getting a medical procedure done to make sure it's done right. And, we have patients at full implant choice. They fly in from other states. And we're starting to do revision work more, probably almost more than we're doing first time work at the moment. And so it's really starting to hit close to home.
Sure. Sure. Yeah, no doubt about it. And for everybody listening, we're only into a couple minutes left here in this show. You can always get in touch with Dr. Adam Hogan and the staff at Full Implant Choice in Virginia Beach. Call them, pick up the phone, get a consultation scheduled now. Take it you or your loved one. And when you said that, Dr. Hogan, I got thinking about it. It's a shame because people, as we know, they wait years before finally getting their dental implants because they'll have the missing teeth, they'll have the denture for too long before they finally step into the world of dental implants. And they always make that, or a lot of times they make that comment, I should have done this earlier. To imagine finally doing it, finally making that decision for yourself, but going to the wrong surgeon and having to get it done again. How much time in between are you just like, I don't want to do this again.
Yeah.
So then you take more months off in between because you're so perturbed. There we go. At the first situation. But knowing that you can do it right the first time, you can go to a doctor with the 10,000 plus hours of experience that we always talk about that makes an expert. And you can find the staff that can back it up too. That's Full Implant Choice in Virginia Beach. Into our last 2.5 minutes of the show, what are some parting words for our listeners that have hung with us?
Yeah, this is kind of a special, presentation show, if you will, because, the circumstances being in Denver and being here for my wife and to get things done correctly and following up at the revision after a bad procedure, a procedure that frankly made things worse the first time. um it just brings everything home about how what I say about getting things done right the first time. And we certainly thought we were doing our diligence when we took the advice of friends to see particular individuals and people, but we should have probably researched more into what's going on with the procedure, what is the complexity of the procedure, and who is the very best doctor in our area or the country to go and get this done at. Had we known that it was such a complicated procedure, we probably would have done more research. Now, what we do at Full Implant Choice is a very complicated procedure. Now, for those of you who can see me on video, we are putting a prosthetic, a set of teeth in your face after surgery on the same day. It's a very complex procedure. Doesn't hurt, by the way. Easy to do for us. We have a lot of experience doing it, but it's very complex. Easier for us because we do it every day. And we sort of take that for granted. And I want to help people avoid making the mistake of just choosing cheap or choosing convenient or quick. Understand that this is very specific and it takes a lot of experience to do well, because I don't want you to find yourself in the position that we're in here personally in another city trying to fix something a second time.
Yeah, no, good words of wisdom. And Dr. Adam Hogan, we thank you so much for being here with this hour with us. Really appreciate that.
Thanks for having me, Damien. I'm going to go get some sleep.
You do that. You do that. And in the meantime, everybody listening, give a call. Schedule a consultation now for fullimplantchoice.com or call 757-629-4259. That's 629-4259 or fullimplantchoice.com. Dr. Hogan, thank you so much. I'm Damian Hall for News Talk 790 WNIS. Enjoy your evening.
Thank you, everybody.